All right. This afternoon's discussion, tonight's discussion, will focus on the film The Witch, right? So where do we want to start? No wrong answers.
Please. So I think when witch hysteria is discussed in the context of 17th century colonial America, it's often done in a way that really has a moral and intellectual indictment of the colonists as somehow really ignorant and stupid and simple-minded, and it's done in a very judgmental way. I think what The Witch does really, really well is it, for the viewer, builds a sense of empathy in showing the world that they truly believe they lived in. If the devil is real and has an impact on history and the natural order, if witches and covens can hex your family, if evil is real, then persecuting people, trying to find where evil is coming from is rational. And so I think what The Witch does really well is build that sense of empathy for the viewer, to not view people as part of some psychosis, but as acting rationally based on what they truly believe the world to be.
Yeah, it's hard to dislike Thomason. It is, and I think that was by design. Mm-hmm. And what you're describing is usually in psychiatry, sociology, referred to as chronophobia. Our wonderful capacity to apply today's standards to hundreds of years ago, which is way off base here. This particular family is actually removed from their community and must live in isolation with the imminent threat of whatever that forest, whatever that wilderness brings. And I think in movies like this, the over-the-top message then is to just sprinkle a little bit of the supernatural in it, which is consistent with our culture's beliefs. Right? So I completely agree with you, and I also agree how, because we do, I'll own this, I like Thomason, I want to like Thomason, it does allow for the viewer to have empathy, irrespective of what might really be happening in this film, which is what we're about to tackle here, right? She's about the same age, maybe a little older than Abigail and Elizabeth, the 9 and 11-year-olds that launched, if you will, the Salem witch trials. So the two young girls who were afflicted with distempers, may have had a mental disorder. I think the physician's name was Griggs, who, very similar to a psychiatrist, a non-psychiatrist in 2024, did render the medical opinion that whatever was going on was not due to the direct or physiologic effect of an underlying medical condition. Right? It's exactly what psychiatrists hear about in consultation. Again, with some degree of chronophobia, psychiatry at the time was merged with religion, right, and spirituality. What else is going on with Thomason, since we kind of began to focus our attention on her? What are some of the things you observed?
The fact that she is not necessarily entering puberty, but she is a young woman, and that theme just seems to resonate in this film, in the sexuality aspect of that. It seems like it's a bad thing. Her body, her being young, her being beautiful, is an issue. In that, further, in my mind, I felt like how do I say this? Her mother, although she's fertile, her mother is not as pretty. Her mother is cold. Her mother is judging and has this religiosity about her, and seems to really hate Thomason for her youth. That's what I saw.
And we do know, is there actually explicit evidence that this is her biological mom? And the only reason why I bring it up is because as you're describing this, my mind couldn't help but go to Walt Disney and the evil stepmother, And I just wondered out loud, but I mean, I think for all intents and purposes, this is biological mom, but it's Disney-esque with regard to the, I don't want to use the word hate, but the envy that's coming through this character. Let's talk a little bit about anxiety. And let's talk about when anxiety is suppressed or repressed and then is uncorked, maybe in the terms of a panic attack, right? And maybe discuss panic disorder as a result, and the metaphors that play through in this film. Multiple theories, multiple perspectives on what causes anxiety. So I do want to start with the most basic or historically appropriate, which is Sigmund Freud. All right, so what's Freud's explanation of anxiety? Where does it all start? Where does?
Unconscious.
Yeah.
I don't.
Exactly right. I was going to ask where does the story with Freud always start? The unconscious, and can you give me some specific terms and how Freud actually described the topography of the unconscious?
Ego and superego.
Good, right? And which one comes first?
Id.
The id, right? Which would include Thomas's impulses, which are biological drives. So again, at her age, we know what that means. We also know that she has got a developed, if not overdeveloped, superego, and if we have any question about that, we just look at mom and dad, right? By the way, same with us, right? Parents and then parental extenders help build that superego. The id, which is governed by the pleasure principle, and the superego, the reality principle, will never see eye to eye. All right? And that friction between the two, between what you want to do and what you're allowed to do, Freud called anxiety. Tell me the role of the ego in all of this.
The ego is trying to find the balance between the superego and the id.
And if it's able to, we call it ego strength, and someone with ego strength will have what outcome when it comes to anxiety?
Coping.
Yeah, right. You should be anxiety free. Your anxiety should be subclinical, right? So here we are. All of our ids and all of our superegos are in that conflict, have that friction. Yet, cumulatively, not much anxiety in this room because of ego strength and what the ego brings to the proverbial table, and that is alleviating the anxiety caused by that conflict, that friction between what we want to do and what we're allowed to do. If the ego defenses are maladaptive, if they are easily overcome, if they give way to an overburdening or domineering superego, this could erupt, right? And what I think was really interesting in my take on this story is that if we are envisioning, or if we think of Thomason's unconscious as a bunch of repressed drives and desires and impulses, she erupts. And some of the impulses that we think, well, they're age appropriate, and even though mom and dad wouldn't agree, they're going to come through. Some of the other impulses that we also kind of side with mom and dad that are incredibly inappropriate, culturally taboo, they're going to come through too. Hence why there's cannibalism in this movie. Right? So I wonder if the ending of this film is actually a product of this eruption, otherwise referred to as a panic attack. Right? Now, again, it's metaphorical, how this is actually played out in a supernatural horror film, The Witch. But I think anxiety in that discrete episode where anxiety reaches a peak, usually in 10 to 20 minutes, and then dissipates over 30 plus minutes, is consistent with what we would expect in someone who has a panic attack due to their uncontrolled anxiety, their clinical anxiety. On tests, since some of us have to sit for tests, a panic attack, you could look at the signs and symptoms. I think they all make sense. You're going to probably be compelled to memorize those signs and symptoms so as to identify them on a standardized test. The bottom line is that on tests and even in clinical practice, a panic attack is clinically indistinguishable from an acute myocardial infarction. So, especially on a psych shelf, anyone who presents with a heart attack, think panic, right? Now, the difference, there's got to be at least one line, maybe two, is that while there might be some EKG changes that are consistent with sinus tachycardia, there are no other EKG changes that would actually be consistent with myocardial ischemia. And they might even give you serial markers that are normal. All right, so no evidence of myocardial ischemia. Right, that equals panic. All right. Questions about our formulating Thomason perhaps as having an anxiety disorder. Rule out panic disorder. And by the way, panic disorder is nothing more than recurrent unexpected panic attacks that are clinically significant. Right? Clinical significance includes changes in behavior, one example of which is agoraphobia, or considerable time worrying about the attack. Let's talk about agoraphobia since I used the big word, and then you're going to tell me whether or not agoraphobia is either written in this script in any way, shape, or form, or is metaphorically, perhaps, depicted. So, in the form of a question, what is agoraphobia?
Fear of public spaces for fear of not being able to get out of a situation.
Right. Does everybody understand the fear?
It's like you're afraid to leave the house. Yeah, okay.
And but why?
Because you're afraid of experiencing some sort of often physiological symptoms and you can't escape.
Yeah.
Okay, I see.
Yeah, it's the fear that gives us the definition. Because again, on exams, you're going to get 3, 4, 5 questions of people not leaving their house, and it's true. So
I just remember it from Shameless. There was an episode
Yeah,
with
yep.
someone with Shameless about it.
Yeah, and if Cusack's character,
Yeah.
Joan, right?
Yeah.
Joan Cusack's character. If she's not leaving the house because of fear of becoming symptomatic, that's called agoraphobia. What if, though, Joan Cusack's character told us, switching gears, going from The Witch to Shameless, which I think might be the first time in the history of a you and me discussion. I don't know if those two have ever actually been discussed in the same context. What happens if she actually did see a psychiatrist and she told the psychiatrist, the self-report is that, no, I don't leave the house because of fear of the social situation or the performance situation itself. What is that called?
Social anxiety disorder.
Yeah, right. The two are going to present exactly the same, for all intents and purposes, especially on exams when we try to confuse you people. They're going to present, the first 2 lines are going to look exactly the same. But it's the fear that distinguishes one versus the other. Do either play out at all in this film for Thomason or any other characters?
Mother
The mother.
Mm-hmm.
How so?
doesn't want any of her children to leave the house after the loss of Sam. So, yeah. And I don't think anyone else, but definitely her.
What is separation anxiety disorder? Because I'll tell you, separation anxiety disorder on some standardized exam is going to appear very similar to agoraphobia and social anxiety disorder.
Doesn't separation anxiety disorder only happen really with children? No? Okay.
I think it's fear from being apart from a sort of like loved one or like caregiving figure.
Or someone that provides security in some way.
Yep. And the way on exams this usually plays out is that there's going to be evidence somehow, some way. Now, again, in a clinical setting with a real patient encounter, we ask, right? But we don't get that latitude on a standardized exam. What will happen is that the depiction will be that it's where the individual is separating from that's inducing the anxiety, not where they're going to, right? And one way to do that, is to give multiple venues. So when for example, it could probably be a child, but when they go to school, there's anxiety, if not panic. When they go to piano lessons, there's going to be anxiety, if not panic. When they go to play practice, there's going to be anxiety, if not panic. It's less likely that all 3 venues are incurring or inducing anxiety. The common thread is where they're separating from, and that tips the clinician off that this might be separation anxiety disorder. On the other hand, when that is not the case, and there's inconsistency, you could think, well, it's probably where they're going. And then you ask, what's the fear? Is it because you're going to become symptomatic and escape may be difficult, or is it because of the performance or the social situation itself, the differentiation between agoraphobia and social anxiety disorder? For those three, where do you think mom fits in?
I think separation.
So right now, separation is towards the top of the differential.
Mm-hmm.
Now, there's one more condition that we probably have to discuss because it also, A is an anxiety disorder, and B presents very similar to the three we just discussed. And what condition is that? Another anxiety disorder that often presents with avoidance behavior.
Like a specific phobia.
It could, that could.
Is it
I would-
general anxiety?
Yeah, I was just gonna say.
PTSD.
PTSD.
I think that's probably more likely.
Yeah.
Yeah.
Yeah, so, unfortunately, with the rules of Fright Club prohibit us from talking about PTSD. So we're not going to talk about PTSD. All right. But that's mom, right? That's mom. What if, and here's, not that's a trick question, but a tricky part of the question, again, thinking along the lines of shelf exams or standardized exams. What if it does appear to be separation anxiety, and the individual is about 18 months of age? Then what? Because we mentioned children, right? Then what?
That's developmentally appropriate.
Yeah. Completely normal, right? And that's going to be answer D. So we do need to know the age range, and separation anxiety, this might be the only thing I know about kids, tends to peak around 18 months of age. No idea why I grasped that one single factoid during my pediatric psychiatry rotation.
You're
But
going to be proud.
18 months. That's Barty Desai, thank you. All right. Any other thoughts about mom here? All right. We just want to talk about the witch. What else caught your eye?
She never had clothes on.
Who didn't?
The witch.
No, they often don't.
Yeah. That's what I just noticed when I was watching it.
Yeah, again, I think that's consistent with our conceptualization of the id, where this is coming from. I mean, if you believe the woman, the strange woman, in room 237 of The Shining is a witch, same thing. Yeah.
I was going to say, I read something about how it was like a representation of different sins, so I thought was interesting. Like the different characters in the movie portrayed like lust for the younger brother who was kind of objectifying his own sister. Maybe like pride for the father who had left the village because he didn't see eye to eye with religious groups there. Maybe for, you could say, envy for the mother who was maybe envying the youth. So you could just like see some of these patterns, but it's an interesting thought because I don't know about the twins though. That's the one I'm not sure. Maybe like what, I don't know. Interesting because like with the devil coming into it, you think of like some things, which is not a slight thing.
Yeah, we need to identify the top 7 characters. Yeah, to try to make it. And I can tell you that for someone who's tried to do this well over 100 times, that's not easy. Like the first 4 are usually easy. 5 is a bit of a stretch, and then unless the movie is truly about the 7 deadly sins, 6 and 7 are a bear. Right? That's when you get medical students staring at you like that's a reach. Right? But it's tough. But I mean, this movie clearly is about religion and spirituality. So it's actually something that I think should be part of the discussion. To derail a brief, quasi-brief tangent, you had mentioned that a discussion of 7 deadly sins does not necessarily have to do with psychiatry, but the personality disorders actually are very nicely aligned with the 7 deadly sins. So, a hypothetical question, and I'm certainly not going to put anybody on the spot while we're live streaming. So this is a yes or no question. So it's not a quantitative question, right? Qualitatively, yes or no. If you had the challenge to name all the personality disorders, and you were told you get full credit, all duty hours, signed, sealed, delivered tonight, you're done with your rotation, if you can name all of them, versus miss one, and you got to go back and repeat your undergraduate degree.
For undergrad?
Yeah. Would you take that challenge? Who would take that challenge?
I
And I
wouldn't.
probably, the person that raises their hand will not be picked on and called upon to do it. Right? Yeah, that's. So, and you know, this was a concern of mine because for our second year medical students, the person that actually taught personality disorders was yours truly, which means that this was a total mark on my record in terms of how well I taught. So, if there's a two-step process to this. Number one is to look at the 3 cluster A personalities, and similar to the APA as of 2013, convince yourself that they are really not true personality disorders as much as they are prodromes to psychotic illness. Right? In 2013, in the 5th revision of the DSM, schizotypal personality was copied and pasted into the schizophrenia spectrum and other psychotic disorders chapter of the DSM, right? And there's going to be a move there, etiology, right? Spectrum. And if you understand that, you quickly realize, okay, paranoid personality, schizoid personality, and schizotypal, because they're part of the schizophrenia spectrum, which leaves you only 7 personality disorders that are fulfilling clusters B and C, 7 deadly sins. All right, now, I'm going to just leave that as a teaser right now. Later on today, we could actually gamify this and see who could come up with the 7 and match them correctly. But for purposes, I think, of the discussion on the witch, we'll stop there for now. Other observations here. Discussing the witch, Thomason and family. I'm surprised that nobody's brought this up yet.
Something about the dog?
No,
The goat?
in part.
Because the goat, I know the goat in general represents, like, I don't remember exactly what it represents, but I know it's like a figure of the devil and a lot of other mediums. So I recognized that instantly when I first started the movie. And when I first saw the goat in the movie.
So what does the goat do to fulfill that or be consistent with that observation?
He impales the father.
Anything else?
Apparently turns the goat's milk into blood.
Right. Did anybody witness that or observe that?
Mm-hmm.
Who?
Thomason.
All right. So again, here we're back to Thomason again. So Thomason walks through that door, right? Has a seat, and gives us her story. Right. She's made an appointment with Suite 2200. She's in the right place, and she tells us her story, which ends up being the plot of the very film you just saw. What is going through your mind?
She's psychotic.
Yeah. All right, so let's see. All right. When we begin to view films through a psychiatrist's lens, the first thing I want everyone to consider after that, what they're hearing is, or in the case of film, what they're seeing is completely normal, is step 2, that when there's evidence to the contrary and we're dealing with abnormal behavior, to make a commitment. Is what Thomason is telling us, is what we observed Thomason enduring, A, mood anxiety cluster, or B, a psychotic dissociative cluster? Does anybody here, detractors, raise their hand, you're not on camera, A, mood anxiety? Right, so we think she's psychotic, right? If psychotic, then we have to consider one illness from which to work. We're going to run our differential through this one illness that's arbitrary, but we're going to choose schizophrenia, right? This is the point where we're going to demonstrate, step 3, your knowledge of the DSM by giving me the inclusion criteria, the 5 criteria that a person must elicit or depict to be ruling in for this condition, schizophrenia. What are those 5 symptoms?
Hallucinations.
It's 1,
Delusion?
2,
Disorganized behavior of speech.
3, 4. And I'll give you a hint. Everything that everybody just named are positive symptoms.
The flat affect?
Negative symptoms. Good. Flat affect being one example. Good. All right. You need 2. Let's check in. Does Thomason have at least 2?
Yes.
I think so. I mean, sometimes in film it's really hard to tease out delusion versus hallucination because you don't know if you're looking at what the person believes they're seeing versus what is actually being seen. But when in doubt, I check both boxes because it just, if anything, allows us to have more of an academic discussion. I'm also not convinced that she doesn't have a restricted and flat affect. I mean, sure, she has this affective flattening too. Might be some negative symptoms, but I think she has at least two. By the way, that behavior at the end looks a bit disorganized as well. Right? Next step, I think we're up to step 4 now, is the appreciation that this condition, schizophrenia, is a diagnosis of exclusion. So now you're going to tell me the 5 conditions the clinician has to investigate, evaluate for, and rule out in order to continue to work up schizophrenia.
Some sort of menu.
So, good. Primary mood disorder, 1. Schizoaffective disorder, 2. Good. Substance-induced psychotic disorder, 3.
I was going to say medical condition.
Due to an underlying medical condition, 4.
We said substance.
Not in the context of a mood episode.
We said mood.
Oh,
Yeah.
okay.
Autism spectrum disorder or ASD. Those are your 5. Any one of those 5 seem likely here? And the way I usually do this, and I actually have done this, is to bring up the script and use the search function: substance, drugs, alcohol, illness, medical illness, autism spectrum. Would you find anything in the script? No, I'm getting a no. No. All right. We could deep dive this more in terms of the symbolism and maybe metaphor, but let's not do that right now. Let's just say it does not appear so. Right. The last step, the 5th, or the way, depends on how you're counting, the 6th and final step of the formulation process is a mental exercise. If you nerded out and if you took notes on this film, and right now you're looking at your notes page, and everything we just discussed, everything, schizophrenia, schizoaffective, substances, medical conditions, autism spectrum, etc., were crossed off. And you had a notes page in front of you, we'd have everything crossed off or highlighted. Would there be anything left on that page that is not yet accounted for? Because if the answer is yes, we have more of our discussion, right? Because we have to discuss extending our differential to account for the missing information. If you're telling me that everything you saw, perhaps even took notes on, is explained away, that's our case formulation of what ails Thomason.
PTSD.
So we did actually bring that up. No, but it's good to visit that because in the structured formulation we did not. It's not there yet. And given the fact that a lot of this appears to arise incident to the loss or the death of her infant brother, that trauma may be something we want to explain a little bit better. So I think adding post-traumatic stress, and given that post-traumatic stress disorder does have a significant element of dissociation, is noteworthy here, right? Because any dissociative episodes that we think Thomason is enduring is now accounted for, right? And it's a nice bridge too, because a large, and this is emerging research, but a significant portion of individuals with a psychotic illness do report as a high 80% lifetime prevalence of dissociation and vice versa. So there might be something there. So now, I will also tell you, and I don't think we're going to see this live stream, and maybe we're going to shut off Zoom, piss some people off, but bring it to the Q&A, a little bit of a teaser. There's evidence in this movie to suggest...
Wait, should I turn it off?
No,
Oh,
not yet.
okay.
Hang on,
Okay.
guys, not yet. Everybody's scrambling now. I think there's evidence in this movie to suggest that her symptoms actually predate the loss of her brother. So I'm not so sure that everything we see is incident to, is it Samuel?
Yes.
Yeah,
Mhm.
Samuel's disappearance.
Mhm.
Right, so we'll discuss that conspiracy theory in a little bit. But before we do, what other observations do you have?
I think complex bereavement can be considered because after the loss, there's also, I mean, we haven't talked about it yet, but MDD with psychosis. I mean, that was on the differential for
Yeah.
the first one, but
Yeah.
the mother specifically is obviously also having hallucination or potentially having hallucinations and delusions as well.
Yep.
so-
Yeah, I think if we're looking, and we could pick mom, we could pick Thomason. If we mention primary mood disorder, must be in a differential to ultimately rule in schizophrenia, and we think, wait a minute, there are characteristics here, I think, that support a primary mood disorder. We have to move this higher in a differential. We even have the etiology for that, right? We have bereavement, and then we have that bridge connecting normal bereavement, which by definition is not clinically significant, to a major depressive episode with psychotic features instead of schizophrenia, right? And that link is persisting complex bereavement disorder. Yeah, so I like that idea because it actually gives us etiology of one of our differentials. What is your gut? Do you think that actually might be put above schizophrenia? Or do you think The Witch is actually a fictional case of schizophrenia in a young woman? I don't think there's a wrong answer, guys. Because if you talk to the writer-producer, I'm not sure they're going to agree with any of the above.
Isn't there an aspect though of like what's culturally like normal though also, because if everyone believes that this is real and we're saying it's schizophrenia because
Only because we're teaching.
yeah,
Yeah.
that's
Yep. That has to that thread is going to cut across everything we discussed this afternoon. Absolutely. Which is where the conversation started. Right. Final thoughts. Any other aspect of the movie that you don't think we've uncovered or discussed enough?
I think we touched on it, but the aspect of like religiosity is very interesting because as you will be continuing on with your trainings, they'll find out sometimes there is a correspondence between hyper-religiousness and what we consider delusion, and it's complicated because, as someone mentioned, like it has to do a lot with like cultural context, and if someone is from a place where a lot of those beliefs are normalized, it's sometimes hard for clinicians to segment between those two, but there's definitely a correlation.
Mm-hmm. And there's also a correlation that's going to even further complicate this, of religion being a protective factor as well. Final thoughts? We'll leave it here, and we'll see everybody back on Tuesday.